Do you feel like your eyes are sore? Well, it could be from a few different things, and each one of these problems would be treated differently. In today's video, we're going to go over all the different causes of eye soreness and how you can get rid of it so you can feel better as well as function better. Hi everyone, my name is Dr. Saya Nagori. I'm a board certified ophthalmologist and you're watching the iFacts.com channel. So what does having sore eyes really mean? Sore eyes can feel like burning, aching, pressure, or even a gritty sensation. But why those sensations happen is not always obvious. Sometimes the soreness can be mild, and other times it can signal something that is more serious than just simple irritation. The tough part is that different eye conditions can feel almost the same at first. So how do you know which one you're dealing with, and what should you pay attention to before you decide whether it's something that you could treat at home or when it's time to see a doctor? Now remember, this video is for educational purposes only, so if you have real concerns, talk to your doctor first. First, let's get into what are the most common causes of feeling like your eyes are sore or eye soreness. So you may have expected this, but dry eye syndrome is one of the most common causes, and it can actually cause discomfort that seems out of proportion to how normal your eye may look, meaning your eye doesn't even look red, it doesn't look irritated at all, but it still feels really sore and uncomfortable. Many people who have eye soreness that's related to dry eye may also notice that the soreness gets worse with the use of screens, computers, wind, or long stretches of concentrating or doing visually focused work, like maybe going for a really long drive. Now, dry eye is something that's more chronic, means that it lasts longer and is probably an issue that'll go on for months and sometimes even years. But there also are acute problems, meaning short-term problems that can cause eye soreness. Viral conjunctivitis is also another cause of eye soreness. This can cause eye soreness even before the eye starts to look red, which can be a little confusing. But once full-blown viral conjunctivitis sets in, the eye is pretty noticeably red, unlike soreness from dry eye, which can look pretty normal. Now, viral conjunctivitis can lead to a deeper soreness when the surface of the eye becomes inflamed, and typically starts in one eye, and then you'll also notice it in the other. And this is because viral conjunctivitis is highly contagious, so you end up transferring the infection from one eye to the other. Now, unfortunately, viral conjunctivitis has to run its course, and there's no antiviral that we give to make that course shorter. But you can relieve the eye soreness from viral conjunctivitis by using cool compresses as well as artificial tears. And a lot of patients who have viral conjunctivitis find this to be very, very helpful in relieving their eye soreness. Now, if you're someone who has eye allergies and allergic conjunctivitis can also make your eye very sore. Now, this can add a layer of confusion because allergic conjunctivitis also causes itching, which is typically not the case for dry eye, but it can be the case when you have viral conjunctivitis. This is when getting a doctor involved is really helpful because the doctor is able to really figure out exactly what the cause of the eye soreness is. Now, you may be surprised to hear that eye soreness may not just be from a problem with the eye. It can also actually be from a problem with the eyelid. Eyelid problems like blepharitis or meibomian gland dysfunction can create irritation that can last for weeks or even months. This is not only because the eyelids are inflamed, but also because the oils in the eyelids are just not doing their job to protect the eye's surface. And again, if you spend most of your day on a device, digital eye strain can easily make your eyes feel more sore and more tired. So here is where people get stuck because some causes of eye soreness can be so frustrating, but they usually are not dangerous. But then some causes of eye soreness seem mild at first, but they can progress to something dangerous pretty quickly. So how can you tell the difference and what should you do about your eye soreness? Before we get into treating eye soreness, it's important to understand what makes certain type of eye soreness more dangerous than others. Angle closure glaucoma can cause eye soreness, but this also progresses quickly into severe pain, blurred vision, nausea, and a pupil that looks like it's a little bit dilated. This problem escalates fast. And if you have really severe eye soreness or eye pain with eye redness, you need to go to the ER for treatment. This is not something that you're gonna wanna wait to get into the next doctor's appointment for. Scleritis is another eye problem that can cause really bad eye soreness in patients. This type of eye pain feels very deep and boring, and it may even radiate and spread to other parts of your face. So scleritis creates this boring, penetrating pain that can actually wake people up from their sleep. And typically the redness has a very dark, violaceous hue to it, and touching the eye can make the eye even more uncomfortable. Sometimes even moving the eye in different directions can make the pain worse. The interesting thing is only part of the eye may appear red and the rest of the eye may not appear red. So the redness can be very focused into one area. But scleritis is actually a problem that really needs immediate medical attention. So you do want to go in and see your eye doctor if you have any eye redness associated with eye pain. Without treatment, scleritis can actually damage your eye permanently. And this is why it's important to get a doctor involved as early as possible. So when it comes to eye soreness, the important questions that I ask as an eye doctor are, when did the eye soreness begin? How long has it been going on? Did it come on gradually or suddenly? Do you have vision changes associated with it? Is there light sensitivity? Do you wear contacts? Because contacts puts you at higher risk for eye infections. Did you wake up with the pain? Or did it start to happen as the day went by? In general, I say that any eye pain associated with eye redness and eye soreness is really important to get checked out as soon as possible. Severe eye redness that comes on quick and has pain is usually the sign of something not good. An eye that is not red but that has felt sore for weeks may be something more related to dry eye or allergies. But again, it's always good to check with your eye doctor because there are some forms of very low-grade inflammation that don't seem really bad or very painful. But if you have that kind of inflammation for weeks or months, this can slowly damage your eye. So bottom line, if your eyes are sore and it's been going on for a while or it's come on suddenly and is painful, it's a good idea to go get checked out. Treating eye soreness depends on the cause, which is why those questions earlier were so important. Eye soreness from dry eye should get better with the use of artificial tears, warm compresses to treat any eyelid problems, being more conscious about taking screen breaks and blinking more, and just less screen time in general. Allergic conjunctivitis that's causing eye soreness should get better with using anti-allergy medication, whether that's antihistamine eye drops, avoiding your triggers, or using oral allergy medication. Eyelid issues will get better with the use of warm compresses and treating any meibomian gland disease. There's another video on the channel all about meibomian gland, so be sure to check that out as well. Hope you found this helpful. Remember to hit like and subscribe below. If you have any questions about eye soreness, drop them in the comments and I'll try to answer them in a future video.